Eximia is the new equipment for the professional treatment of the imperfections of the body and the face, born at Janus's house. Produced with a stunning and elegant Italian design, Eximia is not only a tool to face the imperfections caused by the cellulite. Eximia is a complete, real method, thanks to which the professional can solve every need that a treatment body can require to face, acting in a global way and with an aesthetical objective to correct, improve and heal. The first approach in the evaluation of an imperfection is to ask for the experience of a professional who, by vision and touch, can express a competent judgment. Eximia helps the professional to frame the gravity of an imperfection through the elasticity of the cutaneous tissue, the degree of edematosis and the sclerosis of the tissue or the flaccid of the same, thanks to the use of the effective graduated tool defined as skin report, that, through a suction vacuum of a few seconds, allows to frame with absolute certainty the imperfection we are dealing with. And it is possible to record the values gotten with the skin report on an electronic card, together with the opportune treatment suggested by the software of Eximia, personalized for every single client. The treatment Eximia starts with the phase of cavitational ultraporation. This method, Janus patented, is the fusion of the dermo-electroporation and the ultrasounds at low frequency. The cavitational ultraporation guarantees, besides the subcutaneous penetration of the active principles, but also the activation of the metabolism of the adipose tissue and the reduction of the subcutaneous fat. The ultrasounds allow to divide in dwarfish droplets the gel-rich inactive principles previously applied on the skin. Contemporarily, an imperceptible flow of electric tide reduces the adhesion among the cells of the epidermis and allows the active principles to penetrate in the subcutaneous tissue. The push of the sound waves of the ultrasounds subsequently favors this penetration, increasing and speeding up the positive effects. In the derma, the active principles and the action of the ultrasounds reactivate the vascularization, the lymphatic drain, and the tone of the collagen and the elastine. The ultrasounds at low frequency, in fact, have the function to propagate them deeply up to the hypodermis, where they directly act on the adipocytes, also defined as cells fat. The vibrations and the small waves of compression and decompression separate the fat contained in the cells. The penetration of the active principles inside the cellular membrane is favored by the contemporary issue of electric waves that activates the momentary opening of channels on the surface of the same membrane. To this point, the adipose cell, stimulated by the active principles, easily metabolizes the inner contained fats. The treatment Eximia continues with the exclusive massage Endolift applied through its ergonomic handset. This phase allows the drain of the excess liquids, helping the reactivation of the lymphatic vases. It promotes the oxygenation, improving the capillary vascularization. It removes the already present wastes or the fats from the precedent treatment of the ultraporation. It reshapes the imperfections, the nodules, and the aspect of orange skin or mattress-looking skin, and it hardens the superficial and deep tissues, obtaining a real rehabilitation of the derma and the hypodermis. Eximia includes 22 programs for the connective massage for the body and 6 programs for face treatment. They are all simplified by an effective schedule of the action of the Endolift in programs that act on the superficial tissues and the program that act on the deep tissue. The pneumatic massage done by Eximia throughout the handset for Endolift consists on 4 phases that are repeated with adjustable frequency. It deals with an aspiration, followed by a positive pressure, followed by a new aspiration, to finish with a break. The sequence allows a vacuum pneumatic massage of high effectiveness and particularly pleasant to receive. The phase of positive pressure that alternates 2 phases of aspiration allows to get an increase of the elastic abilities of the skin and the subcutaneous tissues. While the first phase of aspiration causes a congestion of the tissue, the phase of pneumatic pressure allows the decongestion and favors the lymphatic drain before passing to the second phase of congestion and press. The break in which a cycle concludes limits the stress of the tissues, making them return to the initial positions. This sequence allows releasing the separation of the handset from the skin to times and frequencies checked. The presence of passive rolls inside the handset guarantees the glide without attrition on the epidermis, and it doesn't require wearing stockings, as it causes no trauma on the vascular component. The resulting massage is particularly pleasant and absolutely sure for the health of the tissues. The alternation of the 4 phases allows the drain of the interstitial liquids, the expansion of the microcirculatory systems and the lymph of the dermis and of the hypodermis, and the rehash of the imperfections, of the nodules and of the fibrous bridles typical of the most advanced phases of the cellulite. During the phase of superficial derma massage, the handset for Endolift is fit on elevated frequency of 70 to 120 cycles per minute of vacuum, pressure, vacuum, pause, inhaling and releasing the superficial cutaneous and subcutaneous tissues, particularly the epidermis and the dermis. The alternation of phases of vacuum and pneumatic pressure helps the reactivation of all the microcirculatory activities of the derma, improving the activity of the lymphatic vases, the capillary arteries and of those venous. This function, defined emmoriologic, favors a best oxygenation of the tissues and a simpler elimination of the cinders of the cellular metabolism. The interstitial liquids, accumulated at the derma and in the hypodermis, are drained through the intercellular spaces and carried to the small lymphatic vases. During the phase of dermo-hypodermic deep massage, the handset is adjusted to medium-low frequencies, low of 30 to 70 cycles per minute, always divided in vacuum, pressure, vacuum, pause, inhaling and releasing the superficial and deep cutaneous and subcutaneous tissues, and acting both on the derma and, more properly, on the hypodermis. The width oscillations of vacuum and pressure helps the activities of ungluing of the superficial tissues from those depths, removing the synechies and fibrotic shoots that cause the aspect to mattress-looking skin of the fibrous cellulite and sclerosis. This action also favors the activities of revascularization and the repair of the tissues that appear healthier and compact, also determining a remarkable improvement and a gradual remolding of the tissues' loads of nodules, present in the cases of inveterate cellulitis.